is that part of the package that went out to the board?
There was no package that went out to the board.
No, that was when I came in on Monday and was waiting for Joni to talk with her. And I ended up talking with some of the other staff members for a little bit. And that was when Gwendolyn told me that she had received or was going to be receiving a application for home health director. But my understanding at that moment in time, even on Monday, was that it was not just a thought process. It was on paper. So
So who drafted this agenda?
I do not know.
I did that the agenda because I emailed that to all the board and let the board suggest their suggestion if they're going to pull out some of the agendas, because for me that's really important on this company while the remaining people waiting for this answer. So I don't know if the board is going to change that. So I'm waiting to them to finalize that agenda, but there's no response to that.
Okay.
So who directed you to put the two additional items on the agenda from the original agenda from yesterday?
That's me only. There's no one directed for me. Because the one that has the health benefits insurance, Johnny mentioned to me that I need to create an health insurance outline, because that's what you said to her. She goes to the courthouse and said that the board will going to increase the package of health insurance. So that's why she told to me that Jennifer told to me to make you a spreadsheet for that.
Right.
Second, and the turnover, because Johnny, it's been a week that she doesn't come over here, so there's no turnover coming in. So we're waiting. There's waiting of the papers or the work pending that was going to do to shoulder all her works. So we're hanging up here. So no one's taking an action.
Okay, so what I'm hearing is that you were not directed by a board member to send out a new agenda. You took it upon yourself to send out a new agenda. Is that correct?
No.
So who directed you to send out the agenda for tonight's meeting?
Okay, give me 1 second. Give me 1 second. I didn't do. Okay. The two boards told to me that I need to create an agenda and send to the individual board members. And then I messaged individual person and I said, please, here is the Board of Health special meeting agenda. Please let me know if you have any additional items or items that need to be pulled out on the agenda and need your response ASAP.
Use voice commands while driving.
So
You said 2 board members directed you to do the agenda. What 2 board members directed you to do the agenda?
Miss Cathy, she's the one who told to me because she talked to Isaac to do that, because Isaac, he can't do it because it's in the hospital.
Okay.
So there are 2 members, Cathy and Isaac, do that. So
Thank you, Gwendolyn.
If I could just suggest the board, I apologize, but before Joni's last day, I can work with Gwendolyn to get the package out to the board members. We can reach out to the individuals to see if they're interested in coming. And we can get the agenda format as it was changed at the last meeting. And to the members of the public, I understand it's frustrating. It's a steep learning curve trying to get the new board into compliance with the open meeting and just how meetings work. There's not a lot of experience.
So what are the rules of the board members? Are they allowed to talk to each other away from the board meeting? or they have to make sure that the majority of them are all on the same page instead of a few.
Since we have a board of three, the board members cannot have any discussions on Board of Health business outside of an open meeting.
Well, then I think it's a major problem that we have two board members directing a staff member to make a new agenda when the director is still in her position and the staff member is not taking their direction from the director. This is a big overstep of our board members.
It is, and that's why the commissioners came tonight to help get back on the right track.
Yeah, so we need to like address that. Like this is the elephant in the room that we're just tiptoeing around. Thank you for
So
the
Jennifer, are you talking as a commissioner or a board member?
I'm not the one
She's
talking.
not talking.
No, who is the one talking?
This is Alicia, Catherine.
Okay, Miss Alicia, my name is Kathy. And,
Kathy. Catherine, on your screen.
well, I'm Kathy. And you know that. So this is not an overstep of the board. This was according to the board policy that I went through on the training and specifically asked about. There is room for board members to communicate about agendas without violating sunshine laws. In that case, Isaac was in the hospital. Gwendolyn told me that he was in the hospital. And there were major things that need to be discussed at the board meeting, and we did not have a copy of the agenda. So when I asked her to make sure that certain things were on the agenda, these were things that the board has previously talked about that still need to be addressed.
So, I mean, we do have point two where Isaac's not here. The other thing too, I just want to reiterate, the board has no supervision over employees other than the director. So you can say hi, but there should be no discussion over an employee's job from a board member. They should all flow through the director.
And I have had my computer all week.
I can be down here Friday afternoon and get the packages put together for another meeting. By that time, I should be able to reach out to the two individuals to see if they are interested.
Yeah, you're referencing tomorrow, Friday. Or,
I'm sorry, but I have Monday afternoon with them.
okay.
This is Wendy, the physical therapist. I have one question about protocol. Is it protocol for a board member to come to this office and question employees without other board members being here?
Absolutely not. That is a major violation.
How is
I
that a major violation when I'm there under the direct invitation of Joni to come by at any point, at any time? And in her words, she's told me in multiple meetings that it's open, I'm to ask questions. And I was there waiting on her, not knowing that she wasn't going to be there. And then the other people were talking to me, not about their jobs. They were talking to me as citizens about concerns that they had. How is that any different than when Jennifer comes and talks to Joni for periods of time?
Kathy, Joni is the director. The board is supposed to interact with the director.
And you know, we
Yeah.
are grateful because only Kathy is the one who visit in the Bend County here in the office. No one's board member come here and asking how we are here. We don't have a board. We have Johnny is not here. She's up for all week. So no one's going to look for everyone here. So we are grateful for Kathy because she visit here and talk to us what's going on, how she can help us.
I'm just asking.
Stand up that.
I don't know if the other board members knew that she did it. I'm just asking if it is protocol for a board member to do that. I don't know the rules, to tell you the truth. I don't know the rules. I'm just asking, did the other board members agree for her to come? Was this an open thing or?
For a board member to do that, where the risk that becomes if an employee were to be offended or felt uncomfortable by a board member speaking to them, that board member could potentially lose their governmental immunity to where, if there was a hostile workplace claim or any type of employment claim, that board member would be paying all those costs out of their own pocket.
All I know is when I came in the office was locked and there were people talking to a board member. I did not know what was going on and I did not know if it was protocol, if this was set up and I didn't know it, or if the other board members knew that it was happening. I was thrown off course. I didn't know. I just came in, the doors of the office were locked, the board member was talking to other employees. I don't know if that's protocol, that's fine. If
He's
it is,
saying it's not. He's saying that's not allowable.
I'm telling you what I saw.
And he's saying that that's not okay. And I hope that the staff and the board is hearing that, because it's not okay for a staff member to be taking direction from a board member, and it's not okay for the board to be interacting with the staff. It all needs to flow through the director.
So,
My question is why the director is allowed to go to the courthouse and talk to the board member by herself and take 1 hour there to talk. Is she allowed to go over there by herself to the
Because
board member?
she's supposed to interact with the board, the staff are not.
So
it's
Alicia, you need to tone it down just a smidgen because you're yelling quite a bit.
I apologize.
What I will say is this. What I will say is this.
Talking going on in here, and I think it's important for people to be able to hear the conversation. I know.
Well, and I agree. So that means I would like to respond.
one person at a time, sorry.
So what I am saying is this. When I came there, I came as the board member to talk to Joni. Joni was not present. I have called Bent County Public Health several times to try to coordinate times when Joni was present, and she has not been present. So this time I did not call, I just showed up. Then, while I was there, I had people that were there that wanted to talk to me. I said, I am not acting for the board. I am not speaking for the board. I am not doing anything board related at this point. If you want to talk to me, I am not doing board business. I don't know if the front door was locked or not locked because I don't have keys, and that was not part of what I do on a daily basis. So, in fact, when Wendy came in, I talked to her. So it wasn't a closed meeting where nobody was having access to board members. What it was I was sitting there having a conversation and a glass of water with some people that were talking to me, knowing I was not acting for the board. I was not speaking for the board. All I was doing was getting information for myself. And then when Wendy came in, I talked to her the same way I talked to everyone else, and then I left. So that is what happened. Now, if the doors were locked, I don't know what the policy is for Bent County Public Health, if they lock doors when people are not on the front desk and they're at lunch or whatever they're doing. I don't know. I didn't lock the doors and I did not hold a closed meeting. I was there initially to see Joni, and I have tried multiple times to go in and see Joni. And unfortunately, I can't go when Jennifer goes because at that moment we have a quorum. So I have to go by myself at a different time. And every time I have made an arrangement to try to go in and see her, Joni has not either picked up the phone or she's not been there. So I went on my own on Monday to find out if I could have a conversation with her, see how things were going on the transition, see what I could do to help her. And instead, she wasn't there, but I had other people that were on staff that wanted to have a conversation. So that is what happened.
I think we're in a position where there was confusion, there was we're in a weird transition moving forward. I think
Say, no, I'm not in the wall.
schedule, we should be able to have answers to who's willing to serve as the interim public health director. That'll take care of the turnover with Joni. We can put together the number spreadsheet for the board and have the applicant packet all within a week. I think that's very doable. And Gwendolyn, I can come and help, but I know I'm keep adding to your jobs, but I'll be here.
So are you thinking you would like to schedule another meeting for the 11th?